Hey everyone, and welcome to a deep dive all about the fascinating world of fungal infections.
Yeah.
I know this is something you've been eager to learn more about. We're going to unpack some of these medical terms and concepts and hopefully make it easy and fun to learn along the way.
Sounds like a plan.
So we're going to be focusing on two major infections today: candidiasis, which is caused by a fungus called Candida albicans,
Right.
and histoplasmosis, which is triggered by Histoplasma capsulatum. So are you ready to explore this microscopic world of fungi with me?
I am absolutely. Let's get started.
All right, so let's start with candidiasis,
Okay.
caused by Candida albicans.
Yes,
Now, this fungus is really interesting because it has something called dimorphism.
it does.
Can you explain a little bit about what that is?
Dimorphism basically means that this fungus can switch between two forms.
Okay.
And this is really what makes it so interesting. So one form is just a harmless yeast, and in fact, up to half of us are carrying this around right now without even knowing it. It's only when Candida albicans morphs into its other form, this invasive hyphal form, that it actually becomes a problem.
So it's got like a Jekyll and Hyde personality.
Exactly.
So what causes this transformation from harmless yeast to this invasive hyphal form?
Well, it's all about balance. Our immune systems usually keep it in check, but certain factors can tip the scales.
Okay.
Like, for example, if you take antibiotics,
Right.
this can disrupt the balance of microorganisms in our mouths and give Candida albicans that opportunity to switch to its more aggressive form and cause an infection.
That makes a lot of sense.
Yeah.
So when Candida albicans does go rogue, how does it actually show up in the mouth? What does it look like?
Well, there are a few different ways that candidiasis can manifest, each with its own unique characteristics.
Okay.
So let's break them down. One of the most common forms
Okay.
is called pseudomembranous candidiasis.
Wow, that's a mouthful.
It is, but you probably know it better as thrush.
Thrush.
And that's characterized by creamy white plaques on the tongue or the inner cheeks. Okay.
That kind of resemble curdled milk.
Yeah.
And these plaques can actually be wiped away,
Oh.
revealing kind of red inflamed tissue underneath.
Yeah, I've seen pictures of that. It doesn't look very pleasant,
No, it's not, and it can be quite uncomfortable.
right?
Now, there's another type of candidiasis
Okay.
that also causes these white plaques that you can kind of scrape off, called chronic hyperplastic candidiasis or candidal leukoplakia.
Okay.
What sets this one apart is that the white patches are thicker and often don't rub off as easily.
Oh.
And it's important to get this checked by a doctor or dentist
Okay.
because it can sometimes be a precursor to more serious conditions.
So white plaques seem to be a pretty common theme here,
Yes.
but I know there are forms of candidiasis that cause redness rather than white patches, right?
Absolutely. Erythematous candidiasis is a good example.
Erythematous candidiasis.
And this form often presents as a red, smooth, and sometimes sore tongue.
Oh.
Now, this happens because the infection actually causes the tiny little projections on your tongue called filiform papillae go to disappear.
So instead of those little bumps that you normally see on the tongue,
Yeah,
it becomes smooth and red.
exactly. And sometimes erythematous candidiasis can also affect other areas of the mouth,
Interesting.
causing redness and discomfort.
Ah,
Think of it like a more widespread inflammation.
gotcha. And then, of course, we have to talk about angular cheilitis,
Yes.
which I've definitely had that painful cracking at the corners of the lips. I never realized that that could be linked to candidiasis.
It often is. It can be very uncomfortable. And sometimes it even involves a co-infection with a bacteria called Staphylococcus aureus,
Oh, wow.
adding to the misery.
Adding to the misery. Okay, and then one more location-specific type. We've got denture wearers
Yes.
and denture stomatitis,
Yeah.
which occurs under the dentures, often due to poor denture hygiene.
Right.
So, reminder for all of our denture-wearing listeners out there, proper cleaning is key.
Absolutely. Maintaining good oral hygiene is crucial for keeping Candida albicans in check. So we've got all these different forms of candidiasis, and each one kind of had its own way of showing up in the mouth.
Right.
But ultimately, it all boils down to Candida albicans going from its harmless yeast form to its more invasive disease-causing form.
That's the crux of it.
So are we ready to move on to histoplasmosis?
Let's do it. I'm fascinated by this fungus that seems to have a particular fondness for birds and bats.
All right, well, let's dive into it.
Okay. All right. So to understand histoplasmosis, picture yourself exploring a cave. The air is damp, you're surrounded by bat droppings, and you unknowingly inhale microscopic spores of the fungus Histoplasma capsulatum.
Okay, that's a very vivid image and not a very appealing one.
Yeah.
But does inhaling these spores automatically mean you're going to get sick?
Not necessarily. Most people who inhale Histoplasma capsulatum spores either don't experience any symptoms or have a mild flu-like illness
Okay.
that resolves on its own. We call this acute histoplasmosis.
Acute histoplasmosis.
And it can sometimes lead to small calcifications in the lymph nodes in the chest, which are usually harmless and just kind of show up on x-rays.
So it's like a silent invader for most people.
Yeah, for the most part.
But I'm guessing there are more serious forms of histoplasmosis.
There are. For people with weakened immune systems
Okay.
or pre-existing lung conditions like emphysema,
Right.
there's a risk of developing chronic histoplasmosis.
Chronic histoplasmosis.
And this form often resembles tuberculosis,
Wow.
causing a persistent cough, chest pain, difficulty breathing.
So it's a bigger concern for those who are already vulnerable.
Exactly.
And then there's also this much rarer form
Yes.
that can spread to other organs, including the mouth.
Uh-huh.
What's that one called?
That's disseminated histoplasmosis.
Disseminated histoplasmosis.
And thankfully, it's quite rare.
Okay.
It mainly affects people with severely compromised immune systems.
Gotcha.
When it spreads to the mouth, it can manifest as painful ulcers or irregular lesions, often on the tongue gums or inner cheeks.
So how do doctors actually diagnose these different forms of histoplasmosis?
Well, it involves a little bit of detective work.
Okay.
Doctors will consider your symptoms, your medical history, and whether you've been exposed to the fungus.
Okay.
They might order a chest x-ray
Right.
to look for those characteristic patterns in the lungs that we talked about. But to confirm the diagnosis,
Okay.
they often need to see the actual fungus.
Oh, wow.
And this can involve examining tissue samples under a microscope or running blood tests that detect antibodies or fungal antigens,
Okay.
which are substances that trigger an immune response.
So it's a multi-pronged approach to pinpoint the culprit?
It is.
And then once the diagnosis is confirmed, what's the game plan for treatment?
Well, it depends on the form and severity of the infection.
Okay.
For acute histoplasmosis, supportive care with over-the-counter medications to ease symptoms, like fever and cough is often enough.
So it's like treating a regular flu or cold.
Exactly.
What about the more serious forms like chronic histoplasmosis?
So for those, doctors usually prescribe antifungal medications. Okay. A powerful antifungal called amphotericin B is often used for severe cases, while itraconazole is typically prescribed for less severe forms.
Okay.
But the goal is to fully eradicate the fungus and prevent it from coming back.
So it sounds like treating those more serious forms really requires a long-term commitment to medication.
It does.
Wow. So histoplasmosis is quite a complex infection. What I'm gathering is that it's generally not a major concern for healthy individuals, but it can be a serious issue for those with underlying health conditions.
Right.
And early detection and treatment are key.
You got it.
Okay, are you ready for another twist in our fungal adventure?
Always.
Let's talk about mucocutaneous candidiasis.
Okay.
Is this another type of infection caused by our friend Candida albicans?
It is, but mucocutaneous candidiasis is unique because it's not simply a case of the fungus going rogue. It's actually closely linked to specific immune system disorders that affect the production of a signaling molecule called IL-17.
So the body's own defense system is somehow giving Candida albicans an advantage.
Exactly. In people with these immune deficiencies, Candida albicans can establish a chronic infection that affects the mucous membranes, including the mouth skin and even nails.
Wow, so how does mucocutaneous candidiasis show up in the mouth? What does it look like?
Well, you'll see oral plaques similar to other forms of candidiasis,
Okay.
but in this case, they're chronic and persistent, often appearing thicker and tougher, and we call that hyperkeratotic.
Hyperkeratotic. So it's not just about those white plaques.
Right.
The texture is different too.
Exactly. And what's really important to remember is that mucocutaneous candidiasis can have far-reaching consequences beyond the mouth.
Oh.
It can lead to endocrine problems like hypothyroidism and diabetes mellitus.
So it's not just a localized infection. It can have systemic effects throughout the body.
That's right.
Given the complexity of mucocutaneous candidiasis,
Right.
how is it treated?
It requires a multifaceted approach.
Okay.
Addressing the underlying immune system disorder is crucial, and this often involves specialized therapies tailored to the specific immune deficiency.
So it's about strengthening the body's natural defenses against Candida albicans.
Exactly. And of course, we also use antifungal medications to control the fungal infection itself, either oral medications or topical treatments, depending on the location and severity.
So it's a two-pronged approach.
Yes.
Boost the immune system and fight the fungus
You
directly.
got it. And because it can have those systemic effects,
Right.
it's essential for individuals with mucocutaneous candidiasis to be regularly monitored for any endocrine or other health complications.
This is all incredibly insightful. It seems like the more we learn about these fungal infections, the more we realize how interconnected they are with our immune systems and overall health.
Absolutely. And that brings us to a crucial point. Early detection and treatment are absolutely key for all of these conditions.
Yeah.
Whether it's a seemingly simple case of thrush or a more complex situation like mucocutaneous candidiasis.
Couldn't agree more. Paying attention to changes in our mouths and seeking prompt medical attention can make all the difference.
You've got that right. This deep dive into the world of fungal infections makes me wonder, how much do our everyday actions and lifestyle choices influence the delicate balance of microorganisms in our bodies?
That is a fascinating question to ponder. We've covered so much ground today, from the specific characteristics of candidiasis and histoplasmosis to the unique challenges of mucocutaneous candidiasis.
It's been quite a journey exploring the microscopic world of these fascinating fungi.
It really has been a fascinating journey, hasn't it?
It has. It's amazing how much we've uncovered about these often overlooked microorganisms.
Yeah. We've explored the intricate details of candidiasis and histoplasmosis.
Right.
And we even delved into the complexities of mucocutaneous candidiasis.
They did.
And we've learned that early detection and treatment are crucial, along with maintaining a healthy immune system and being mindful of that delicate balance of microorganisms in our bodies.
Right.
So as we wrap up this deep dive, what are some key takeaways that you hope our listener walks away with?
Well, I think the most important message is that while these infections can be serious, especially for those with weakened immune systems,
Right.
they're often preventable and treatable.
That's good to know. It's not all doom and gloom when it comes to fungal infections.
Not at all. Simple things like good oral hygiene,
Right.
being cautious in environments where these fungi might thrive, and seeking prompt medical attention when needed can make a world of difference.
Yeah, those are all practical steps that everyone can take. It seems like there's a growing awareness of the importance of the microbiome and its role in overall health,
Absolutely.
including our susceptibility to these infections.
Yeah, the more we learn about that intricate interplay between our bodies and the trillions of microorganisms that call us home, the better equipped we are to prevent and treat a wide range of conditions, including fungal infections.
It's a good reminder that we're not just individuals, but complex ecosystems.
Yeah,
And this deep dive has really highlighted the interconnectedness of our health with the environment as well.
Absolutely. Factors like climate change and deforestation can influence the spread of these fungi, which underscores the importance of protecting our planet.
Yeah, it's a call to action on multiple fronts: personal health, public health, and environmental health.
You got it. And as we conclude this exploration, I want to leave our listener with a sense of hope and empowerment.
Okay.
The field of mycology is constantly evolving, with new discoveries and advancements in diagnostics and treatment emerging all the time.
That's exciting.
So as we say goodbye to this deep dive, let's carry with us a sense of curiosity about the microscopic world,
Yes.
a vigilance in protecting our health, and a commitment to making informed choices for ourselves and our planet.
I think that's a perfect note to end on. Thank you so much for guiding us through this fascinating and informative journey into the world of fungal infections.
It's been my pleasure, always happy to shed light on these often misunderstood organisms.
And to our listener, thank you for joining us on this deep dive. We hope you've gained some valuable knowledge and a newfound appreciation for the intricate world of fungi.
Until next time, stay curious, stay healthy, and stay tuned for more deep dives into the world of science and medicine.
That's a wrap on this episode of The Deep Dive. We'll see you next time for another fascinating exploration.